Be Mindful, presented by the Menninger Clinic.
Welcome back. Soon after our next guest had her baby, she had chest pains, panic attacks, and she thought she was going to die. Turns out she was dealing with postpartum anxiety and OCD. Here with how to diagnose and treat it, welcome back Dr. Neil Puri with the Menninger Clinic and former patient Kristi Elsea. Good morning. All right, so we've heard of baby blues and postpartum depression and even postpartum psychosis with the whole Andrea Yates situation, but we hear less about postpartum anxiety. And when does it become something that we have to worry about? Because I think every new mother, I was up, with the mirror, like, right, is he breathing? He's breathing good, right?
Yeah.
Right. So I think naturally in us is to have some anxiousness, right?
That's
to
right.
make sure we take care of that child. But at what point are we looking at something getting out of hand?
Sure. So postpartum anxiety can occur in up to about 9 to 10% of people. So you're absolutely correct. Anxiety, we all experience it. Mothers should definitely have, and any new parent, anxiety about their child. But when that anxiety starts becoming about things that aren't likely to happen, when it interferes from your ability to bond with your child, when it interferes with your ability to function, that's when it's starting to cross over into the realm of a problem.
Yeah, and then of course OCD,
Right.
a lot of us have some of that too, is like what you don't want to expose your child to and things like that. But again, when it interrupts your life, right? Okay, Kristi, for you, when did you realize that the anxiety part was taking over and it wasn't just the normal new mother?
Pretty soon after my first son was born, it was definitely a just life-altering, very much day-to-day life became extremely challenging. I was sharing with Dr. Puri that at one point I would actually carry my phone ready to call 911 from one room to the other. I would not let go if it was my lifeline because I was alone.
Something was happening to you or happened to the baby?
Both.
Okay.
So I needed help right away. So I always carried my cell phone with me. Just had those intrusive thoughts.
What were the obsessive compulsive disorder things that you're doing? I guess carrying the cell phone was one.
Carrying the cell phone was big. Always something happening with my heart. With my son, I would stop cooking because magically the knives were going to come out of the knife block and hurt him. When we would be around people with a pool, I didn't want anyone to hold him while they would walk around a pool or any body of water because they would drop him and he would drown. Just very, very out there thoughts that for me seemed very, very real, and they felt real.
Yeah. And that's the thing that people need to understand. It really feels real. Okay, and then you're afraid to tell people because you're not sure that they'll think that they're real, right? Okay, so pregnancy can send the body into overdrive. We know hormones, all that stuff kind of go crazy. So if somebody has some existing issues, does pregnancy just make that worse? Because I know you had some kind of a family history. They would describe you as the nervous child.
Yes, just an anxious child. I was nervous to spend the night with friends when I was little. Always had at school, I kind of had a little of that of OCD where I always had my binders had to be very clean and organized. I would get new ones very frequently because I would tell my mom how dirty they would get. So I always had those little kind of quirks that you would call it, but nothing that would ever alarm my parents that, maybe there's something else to it.
Yeah. And is there a connection here that?
Yes, there is. So just because you have something before you get pregnant doesn't mean that it's going to get worse during pregnancy or in the postpartum period. But predisposing psychiatric conditions will be a risk for developing something during pregnancy or after pregnancy.
Okay, so number one, you got to come in, and we want to remove that stigma because you said for a long time you were quiet about it.
Very much so, yeah.
But as you opened up about it, you realized how many other people were dealing with it.
It was unbelievable. When I shared the Facebook post, which is how I got this opportunity, a lot of friends reached out that were just more of acquaintances, and they would write me saying, I had suicidal thoughts. I had the same intrusive thoughts. Oh my gosh, I had no idea you went through this. You seem like the perfect mom. And then vice versa. I had friends that are lawyers and doctors that went through the same thing I did.
Yeah.
And so I just was amazed how common it really, really is, but no one talks about it.
Were you able to get help right away?
I was. With the Menninger Clinic, that was more of
the first place you went?
First place I went. I mean, I went to see I talked to my OB, obviously, but the Menninger Clinic was definitely, my families got together and they just said, this is really impacting your daily life. Let's take you to Houston. Let's get, where I'm from, and let's get this taken care of.
And that's the great thing about the Menninger Clinics. I think a lot of doctors, I had postpartum depression, and I was just told, well, you're old and had a baby, so we're going to give you this for your depression, and you gained some weight, we're going to give you this, and you got to wake up for early morning jobs, so we can give you Adderall. They were medicating my symptoms and not dealing with what was really happening. For me, it was just thyroid, and a couple of days after the thyroid, the depression lifted. However, when it's something like this, at the Menninger, that's what you all do. This is not necessarily just the physical, but that emotional, psychological, and the brain. That's what's important here.
Yeah, we're really looking at the whole person, looking at all factors. So we know in postpartum conditions, it's the psychological stress, the massive hormone withdrawal that you went through, it could be other hormone abnormalities. It could be a psychiatric condition that you're predisposed to that needs a different type of treatment. But really looking at everything, not just you need something to turn you on, something to turn you off, something to help you with weight. No.
Yeah. Okay. So what did the treatment look like for her?
So the treatment for you was a combination of medications as well as one of the best treatments for OCD, exposure response prevention.
I actually wasn't diagnosed with OCD until I came to Menninger. Everyone before then always said, you have generalized anxiety disorder, you're anxious, you're depressed. And so really understanding that OCD is not what you think it is or what the media maybe shows that it is. It's so much deeper than that. And to have my doctor say, the OCD is causing these anxiety thoughts in your head, which is now causing you to be a little bit depressed. But we're going to focus on the OCD, which is major exposure therapy. Yeah. And it was very hard.
Exposure, I would
Very
imagine.
hard.
So exposure therapy, give us an example of what that looked like.
So for me, having the anxiety, the health anxiety related to my heart, obviously I can't go through a real heart attack, right? So what my therapist would do with me is she would have me write scripts. So for me, exercising was really an anxious activity for me, right? Because you
think your heart's going to
exactly. So I would have to walk on the treadmill at kind of a real moderate pace and talk to her at the same time. And every now and again, she would say, "You have your chest pains, right? You're gonna, your heart's about to give out. You're gonna have a heart attack." And so she want to feed my anxiety to the point where I would almost have a panic attack, but she would make me stay on there and walk me through it and just kind of let my body take its course.
And at the end of it, you're like, okay, I didn't die.
Yeah.
I didn't die.
Yeah.
Okay, I didn't have a heart attack. And so that exposure therapy that we talk about, I think the bottom line is that not one size fits all, again, into how somebody is treated, but the thing is you can get help. And what may seem strange to one person is very real to another, and you have to deal with meeting that person where they are.
That's right. And the big thing is if you're going through something, like speak up. So many women suffer in silence with these conditions.
Because we got to be super mom. We got to take care of our baby, right? So this made it easier for you the second time. When you
the
had
second
a child.
time, exactly. You could recognize the symptoms, talk to my doctor, and even the first time around, I didn't explain myself clearly to my first doctor. It was very much, you have the baby blues, you're anxious, this is your first pregnancy. The second time, they were like, okay, you're really anxious this time. Let's really get on top of this.
And your hope is that we kind of bridge the gap between the doctor recognizing something and knowing where to send you. Okay. So for more information on how the Menninger Clinic can help you, you can give them a call at 713-275-5400, 713-275-5400, or log on to menningerclinic.com.